We are having a session on the liver. Starting from the location, we have got basically it is extending from the T7 to 11 vertebral level, and also in the upper right upper quadrant region. Okay, तो हम इसमें पढ़ेंगे क्या basically we'll discuss the surfaces and the lobes. We have 4 lobes, the major, the right one, then the left one, and on the posterior or the visceral aspect of the liver we have the quadrate and the caudate lobes. ठीक है, quadrate because it has got 4 sides, angles. Okay, right. So as I said that there are 2 surfaces of the liver. This is the visceral or the posterior surface, and this is the anterior. Anterior one is kind of smooth, and it has got impressions. The costal ones not that prominent, as you know, they are not that prominent. Costal impression for the costal ribs and the cartilages. And for the visceral one, why it is called visceral? Because it has got the impression for the visceras. Okay, so the total number of impressions that we have on the visceral aspect of the liver are basically 6. ठीक है, 4 on the right lobe as it has got the larger surface area, and 2 on the left one. 2 on the left one includes basically the gastric and the esophageal one, and on the right side we have the adrenal, renal, colic, and urinal. These are the impressions. Okay, this is not an impression, this is the quadrate lobe. Okay, so in addition to all of this, we have got this area which is known as the porta hepatis on the posterior aspect, and it has basically the 3 contents. We have the proper hepatic artery, the common bile duct, and the third one is hepatic portal vein. The visceral surface is done. Now we are heading towards the anterior surface, and on the anterior surface we have certain ligaments. Basically we have 4 ligaments actually. This is the falciform, then falciform is in continuation with the coronal, then coronal itself is in the whole is the falciform, then it is bifurcating into the coronal. We have 2 coronal, and then these 2 coronal again are dividing into the right and the left triangular left and the right triangular of the liver. Extending downwards, the falciform ligament, it gives free end, and that is basically the round ligament of teres hepatis of the liver. And so what the importance is, it is basically a remnant. The ligamentum teres is a remnant of the umbilical vein.